people who may not realize we're in serious trouble, and gentlemen. Recently, the House, again, totally repealed Obamacare. And I hate to throw cold water on this, folks. Even if it passed the Senate, which it won't, and even if Hussein didn't veto it, which he would if it did get by the Senate, even if that happened, let's say, theoretically, folks, let's say Mitt Romney gets elected. Let's just, hypothetically, let's say Mitt Romney defeats Hussein in November. And let's just say, this isn't going to happen, but let's say we even got 60 votes. They could defund this via reconciliation, but let's say we got 60 votes in the Senate. And we totally repealed Hussein Obamacare. And the House passed it, the Senate passed it, Romney signed it, and Obamacare was ditched. We are still in serious trouble, and I know I'll be accused of being Mr. Gloom and Doom for this, but what caught my eye reading the legislation that Mr. Cantor sponsored repealing Hussein Obamacare in the House, he argued against, he's conceded the argument essentially. He says despite projected spending of more than $2 trillion over the next 10 years, and then he adds, cutting Medicare by more than $1/2 trillion. So he's complaining about cutting of Medicare. And I'll get to this more in depth in a moment. Then he says the law, meaning Hussein Obamacare, cuts more than $1/2 trillion in Medicare. And then he quotes the actuaries at the CMS warning that Medicare cuts contained in the law are so drastic. And then he said, CBO cautioned that Medicare cuts, blah, blah, blah. Forgetting that Medicare Advantage is the only decent facet of that program, but it's still funded by tax dollars. And then he says, the law expands government control over healthcare. Okay, let's step back for a moment here. When Cantor and the Republicans argue against cutting Medicare, forgetting, that Richard Foster, the Medicare actuary, he realized this was BS and it wasn't going to happen. But Cantor's essentially conceding the argument to the Democrats where he says, we can't cut Medicare. We can't do that. We shouldn't do that. He's conceding the argument to them. And I realize that reforming Medicare is not going to be done in one fell swoop. It'd be a lot harder than Social Security, but because we have a lot of people who are near retirement and people over 30 may not have enough time to save for it. But we could eventually slowly phase it out to where people entering the workforce wouldn't need to pay into it. Basically leaving people to their own devices and actually allowing people to be responsible for themselves. That's shocking. But I don't think Cantor would get on board with this. When you're arguing against cutting Medicare, you're conceding the argument to the Democrats. And Medicare is on a tear. It's going to continue growing. So what he needs to do is we need to move towards reforming this, not arguing against them saying we can't be cutting Medicare. We need to start, basically, we can continue to fund it for people, let's say, over 30, and everybody under 30, you can set up your own personal retirement savings account or whatever, because the federal government is supposed to have no role in this. But Cantor, I hate to beat a dead horse, is conceding the argument to them, saying Medicare should exist and arguing against these cuts. He has conceded the argument. Do you get it? Medicare spending, if we start at fiscal year 1970, had doubled adjusted for inflation by fiscal year 1977. In that time frame, it had been more than double the rate of inflation. Keep in mind, this is long before the baby boomers started retiring. By fiscal year 1985, it had doubled again, even adjusting for inflation. By fiscal year, 1997, it was again more than twice the rate of inflation. I will again remind you, this was long before the baby boomers started retiring. By the end of fiscal year 2007, it had increased by more than 62%, even after adjusting for inflation from fiscal year 1997. So you can see this program the costs are out of control. As you can hopefully see, this program is heading headlong towards a cliff. It is projected to consume 8.6% of GDP on its own by 2050. Even operating on a rigid price control, costs are spiraling out of control, and that price control is making it more difficult for those on the program to find a doctor, because doctors prefer to get paid when they see a patient. Although Medicare is not nearly as bad as Medicaid, ask any doctor. As far as a real doctor, when I say ask a doctor, I'm talking about ask a real doctor, not some phony doctor here on YouTube pretending to be a doctor when they're not. But go ask a real doctor. Medicaid's even worse. And with the costs in Medicare getting out of control, who knows? Rather than reform it, what they'll probably do is they'll continue this balancing game with price controls. And you're going to see more doctors get pissed off and say, we're not seeing any more Medicare patients, period. Because a lot of them have already dumped Medicaid patients. They will not see them. So what Mr. Cantor needs to do is quit arguing against cutting Medicare. I see what he means. I understand why he's saying that. But don't argue against it. We need to start stripping the federal government from all this, having all this authority in healthcare, which it's supposed to have none, as far as the Constitution is concerned. Because, as I said, he's playing into the Democrat hand. So I'm thinking Mr. Cantor is happy with the big government we have now, as long as it doesn't get any bigger. So I hope you see what my point is there, and see that the trap Eric Cantor is getting some Republicans to run into. They're going to paint themselves into a corner. I don't think it's a great idea to defend Medicare. It's a terrible program, and it's had little or no success. It is going to bankrupt us. Have a nice day.